Okay, well, we're really excited as we are really heading into February's Heart Month, which seems to overtake the city and the conversation. And it's wonderful to bring awareness to the Ottawa Heart Institute. And we are so lucky this year to have Dr. Birnie as our ambassador for February's Heart Month. So it's great to be here in the office. It's nice to finally meet. And this is it's a wonderful honor. There's been some big names that have taken this role on. What does it mean to you to become the ambassador for this?
Yeah, and it truly is an honor and a privilege. And but I'll be honest, I'm not somebody who really particularly enjoys the limelight. So, but I do believe it's also my duty to take my turn, because I think it's very, very important to engage with the community. The community have been so supportive. I've been here for 20 years, and the community has always been so incredibly supportive. So it's I see my role as engaging the community, educating the community, hopefully motivating the community to do even more.
It's wonderful that you feel that, and I think there's a wonderful reputation here in the city for the Ottawa Heart Institute, and you've seen it from both sides. You see the patients, you're, doing the research, but what do you think that people's, thoughts are when they think of the Ottawa Heart Institute?
Yeah, I don't know. It's really a remarkable thing. I trained in Scotland and worked for 10 years as a doctor in Scotland, and so I have that contrast there, where the hospitals were not generally held in high regard, and there wasn't the same relationship between the community and the hospital. So it's really very different. It's really very positive, because it's all about, it's positive in so many ways, because when you have a culture within a hospital, you can't be complacent about that culture. And culture also depends on multiple things, including morale. And the morale in this institution is very, very high, and it's high for many reasons, but partly because the community supports us so well, and it's on a it's on multiple levels with their fundraising and so on, but also their little words here and there when they come and see us patients. It's so important. The morale is just so great.
I think also there's so many grateful patients that are walking around. There's so many people whose lives have been saved because of the Ottawa Heart Institute. And so you see it from that side in terms of seeing and understanding these patients. And I think what a lot of people don't understand is how much goes on behind the scenes. And we are heading into this research campaign, which is very different than seeing fancy new buildings and beautiful operating rooms and all of the new equipment. What does research symbolize? What does it mean to the Institute?
We try and make patients care better, so we try and make them feel better. We try and make them live longer, is the two basic ways that we try and make patients better. But we also try to reduce complications. We also try to improve quality of life. All these things are very important. So research, everything we do in research is focused on that ultimate aim. Now, some types of research, that ultimate aim is a long, long way in the distance. So, for example, we have scientists in the Heart Institute who do basic science, so they're working with cells and test tubes and laboratory animals. So their translation into clinical benefits is maybe 10 or 15 years away. And we've got other types of research where we're actually doing clinical trials in patients, and they can, the end result can be in maybe 3 or 4 years, where we compare two different treatments. But a lot of the research is very complementary. We talk about bench to bedside research. So it starts in the laboratory bench, and then the hope is at some point in the future it'll translate into something at the bedside. So the bench to bedside concept in research is very important, but the ultimate goal is always trying to improve patient care.
When we talk about bench to bedside, what are you referring to? I think I've gotten a much better understanding those within the Institute, but for the layman outside, what does it mean when we're referring to that?
Yeah, so bench to bedside, and one of the unique things about the Heart Institute is we have a mixture of researchers who do multiple different research, and so we can work as teams to truly do the bench to bedside concept. So it's really actually bedside to bench to back to bedside is the real concept. So the bedside physician says, we've got a clinical problem. We've got patients who are dying because of condition A, B, or C, and they go back to the basic scientists and say, can you research this condition and come up with some interesting new treatments for it? So they do the basic research. They perhaps do some further research, and then it goes back to the clinicians to do the clinical research in clinical patients, and then eventually, if that research is positive, it goes back to the bedside. But so really the concept is bedside to bench, back to bedside. But not all research has to go through that loop. Other research can go in slightly different ways, but many questions do need that loop.
And we have that here. I mean, I've often heard of the scientist with the clinician, and the work is really bringing together these heart teams.
Yes.
And it's also understanding that within any patient, there's a number of individuals with different specialties that are bringing in their experience, their knowledge, their research into a patient's experience. Is that kind of what the heart team like? How does?
Oh no, it's you're absolutely right. It's very important, and this is one of the remarkable things about this institution is that there is a critical mass of researchers of all certain types. We are aligned in teams. We do collaborate. We do talk to each other all of the time. So it's another of the remarkable things. There really is this critical mass of very dedicated researchers.
Okay, let's get it, and I'm going to try to understand this, and I've been reading a lot of your material. How would you describe, you're sitting at the dinner table, and someone's like, so what are your days like? What is your research? And I've heard you do wonderful talks, but explain to us what it is that gets you passionate about the work that you're doing and what you're hoping end results are going to be.
Yeah, so I'm a clinical researcher, so I don't do any benchside research, but I have benchside collaborators. But my research program is called patient-oriented clinical research in patients with cardiac arrhythmias. So what that means is it's really a three-step process when we're looking at research projects. So we always start at the bedside with a patient issue or a number of patients issue. Can we treat this? Can we make this patient better more efficiently? Can we make them better? Can we make them live longer? We come up with that question related to a specific disease. Step 2 is we always then look on the internet and do a literature search and make sure that nobody else is already asking the question and are in front of us already. There's no point in reinventing the wheel if somebody's already on it. And the third question is, do we have the resources and the skills required, and or can we get the skills required? So I can give you multiple examples of how that works. So my favorite example is a disease that I do a lot of research in, which is called a disease called cardiac sarcoidosis. So cardiac sarcoidosis is a rare condition, but we still see plenty of patients with it. It's it's a condition where patients have an abnormal immune reaction to something in the environment, but they can present with an arrhythmia. So my story starts in 2004 here. I had just been on staff for 2 years. I was interested in multiple things at that time, and then I had a specific patient came to me. She's still a patient volunteer here at the Heart Institute, and she came to me with she was in her 50s, and she had heart block, and I said, why have you got heart block in your 50s? This is really unusual. But at that time the standard of care was just to put a pacemaker and just to puzzle out. But then to cut a long story short, she turned out to have cardiac sarcoidosis, and she said to me, number one, why have I got this condition? Number 2, how am I going to treat this condition? Number 3, what's my prognosis? And I went and did the step 2, the internet search, read everything possible about the condition, and I came back to her and said to her, I'm very sorry, I don't know why you've got it. I have no idea how to treat you, and I have no idea what your prognosis is. So that's the example of something that needs really, really focused research. So I've spent 17 years now researching the condition. We've now got, we're internationally recognised for our leadership in the condition. We've got lots of, nearly $2 million of Canadian Institute of Health research funding. we've got about 20 projects going, some clinical, some just in the Heart Institute, some all over the world. We've got some bedside projects going as well with collaborators. But that's, an example of how right at the bedside with one patient, I didn't know what to do.
Okay, so can I ask you, 17 years later, what has evolved from that? What have you been able to answer? Why do I have this condition? How can we help this condition? Is that a tough question to answer?
For sure. No, we've learned a lot, and we think we've contributed a lot. We still don't know what causes it. We're a little bit further forward. Again, it's an abnormal immune response somehow. We're a lot further forward in terms of the treatment, and we know that most patients need treatment for only 1 or 2 years, and then the disease goes away. And perhaps the most exciting thing that we've found is that if you diagnose the condition early and treat it promptly, the prognosis is completely transformed. So 17 years ago, when I spoke to that patient, the literature would suggest that she had about a 50% chance of surviving for 10 years. In the last 17 years, it's now over 90% chance of surviving 10 years. So, we've made a massive difference. Yeah. So we're very excited by that, very proud of it. And but again, it all comes back to the institution, the environment, all of the enabling platforms to allow you to do all of that work. Ben, and I say to the young guys, you have everything you need to be a success in the Heart Institute. If you're not a success in 10 years' time, you've only got one person to blame, and that's yourself. You have everything. You have money. You have people to mentor you. You have all of the collaborators you would ever want. You have all the databasing, you have all the statistical support, all the method support. So if you fail, there's only one person to blame, and that's yourself.
I love that you say that, because there's so many other people that are trying to be that support system, so that really at the end of the day, it's simply that individual, that we are going out and we are raising the money, that we are finding the right people, that we are broadening the artificial intelligence and the database. Like, this is all part of moving forward. And the emphasis that we're trying to do as to why funds like this need to be raised.
Yeah.
Because a lot of that doesn't come from the government.
Yeah, no, absolutely. And that's why, again, it comes back to the community being so important. And again, if I give you the example of the cardiac sarcoidosis thing, the way you build these programs is that you can't just come up with an idea and the Canadian Institute of Health Research gives you $2 million tomorrow. It just doesn't work like that. You have to get pilot data, start small projects, and that's where the local funding comes in and is so important to start with. But also all of the funding for all of the enabling platforms that support the environment.
One of the other things I thought was really quite fascinating in listening to some of the work that you've done is we all look at contributing factors, right? Age, demographics, smoking. Like, there's so many things that come into it. And some of the research that you're doing is a lot of the times when there's been a pacemaker, when there's been a device or something that is now within the human body, and what that reaction to infection, disease is going to be like. And one of the things that I thought was really interesting is the first time that I heard it was, if you were younger, that age was a massive factor because you have the device that's in you much longer. This was all part of your studies, like when you talk about the factors. So how important is it for you to really understand each of the factors that's going to affect a patient? And this is coming into much more of like that precision medicine, is what's going to be distinguished between each individual and their individual treatment.
Yeah, no, I think it's very important. There's a lot of things in medicine that are considered laws or written tenets, but when you actually look at the science that supports these things, that actually the science is very modest, and I think it's very important to always go into it with an open mind and start again, and when some questions aren't properly answered. And the example you give is a very good one, and that was a large study, a Canadian collaboration with 19,000 patients that we did, and we were asking multiple questions, but in particular we're very interested in what causes infections in patients with devices. If a pacemaker gets infected, it's really a big deal, because it's not, antibiotics can't clear the infection, everything has to come out, which is a major procedure. So we were very interested in, number one, what causes the infection, number two, can we do anything to reduce it? And one of the things we found out was that paradoxically the younger people were at much higher risk of infection than older people, which is the opposite to what you might have thought. So, and anyway, very scientifically interesting. We still don't understand why, but
that's coming.
That's coming.
The work,
sure.
the work is actually coming.
Yeah.
Where do you see cardiac care in the future? Like, how do you see it evolving?
Yeah, we're in a remarkable time. I keep on using that word, but it truly is. If I look back in the last 10 years of everything that we've achieved, not just in our institution but worldwide, for all of the breakthroughs, the big breakthroughs in the last 10 years have been all of these minimally invasive surgical procedures, the things that the surgeons do, but also now that we can replace heart valves. Heart valve replacement, 15 years ago in many patients was a major procedure. Now it's a much more minor procedure. Patients can go home in 2 or 3 days, and I think in the next 10 years you're going to see more and more of that happening, and that the procedures are much more invasive for patients, meaning that we can treat much older patients, much frailer patients, but also that the recovery is much shorter, a few days rather than a few weeks. I think that's number one. I think number two, the breakthroughs that we've seen in the treatment of heart failure in the last few years have been remarkable. Heart failure used to be this dreadful prognosis, but now the prognosis in the last 10 years has transformed, and I think you see more and more of that. I think number three, arrhythmia is my area, but I think you're going to see a lot of breakthroughs in arrhythmia, in particular an arrhythmia that's very common in Ottawa called atrial fibrillation. I think you're going to see a lot of breakthroughs in the primary prevention of atrial fibrillation, meaning getting really at the disease before it becomes a disease. Why are patients in their 50s and 60s in Ottawa getting atrial fibrillation? We're starting to learn more and more about that, but I think you're going to see a lot of breakthroughs in trying to prevent atrial fibrillation before it happens. I think there was one other one that's escaping me. What else was I going to say? Yeah, those are the final one. I think you're going to see more and more breakthroughs is in the so-called orphan diseases or rare diseases. There's a lot of interest in that, diseases like cardiac sarcoidosis that are relatively rare. You're going to see a lot more centralization of clinics, so that doctors in the community aren't looking after one patient. You're going to see more and more that there's going to be clinics built within institutions like ours to look after the whole region's patients with cardiac sarcoidosis. And there's other diseases like cardiac amyloidosis, multiple examples I can give you, and we're already leading in that area of centralizing care. So if you're looking after 200 patients with a rare condition, you can really start to understand and make big breakthroughs. So I think you're going to see a lot of breakthroughs in these rarer conditions now over the next 10 years.
It's fascinating to be able to see where we can go and how much, and even the discussion around prevention and wellness, right?
Yeah.
Like how can we help bring awareness to people so that they don't have to come to the Heart Institute, right? That's a big part of the conversation as well.
Yep.
Okay, so we're relying on our donors. This is a big month for us. What would you say to them? What is your message to them on being part of the donations, the awareness of what February's Heart Month can do here at the Institute?
I think that you should be reassured that the money will be extremely well used. The Heart Institute is now in a tremendous place. It's recognized all over the world. We're now, I think the term world famous is overused, but I truly believe we're now world famous. But I also believe that we really have a critical mass of researchers now to even go to the next level. There's so many excellent young investigators now, and I think we really have the critical mass to go to the next level. As I said before, the only thing to stop people succeeding now is themselves. But all of those enabling platforms need to continue to be funded. The government doesn't fund many of these enabling platforms, so that's where the donations need to keep on coming in to support the critical mass. Because, you know, if we become complacent, you know, others will get ahead of us, and we can't become complacent.
I can't see a word complacent with any of the individuals that I've met here at the Heart Institute. We are so looking forward to having you share the excitement of Heart Month with us and with our viewers and with our donors. So we really appreciate it, and we're going to reel you in. It's going to be a busy month.
Okay, thank you.